Hey, I'll see my name now.
Yeah, we can see your name. So I'm recording now. So I think we're
Yes.
going to start. The others will join us uh, as we go. Good afternoon, good evening, good morning, everyone, whichever part of the world you are joining us from. So my name is Funmilola Adeagbo. I'm going to be speaking on a topic that is so dear to my heart this evening. Sorry, we're on afternoon here. It's about 12 midday here in Canada. So when women thrive, the community and nations thrive. Healthy women bring forth a healthy community. So the topic I'll be talking about this afternoon is about women's health. Yeah, I think I have to remove this. Okay. So what is women's health? Women's health encompasses physical, mental, emotional, and reproductive well-being. So as a matter of fact, I'm going to add the spiritual health. A few years ago, a psychologist came to my place of work, excuse me, to teach us how to be happy. So he gave us so many points. Then she concluded with this last point that connect to a spiritual power. So I think people recognize this spiritual power, that we can only thrive, we can only be a whole person when we connect to a spiritual power. She didn't mention God, but I knew, we all know that spiritual power is God. Whichever power you believe, you are a Muslim, Christian, you worship Ogun or whatever, she advised we should just connect with the spiritual power. That was why I added spiritual health. Because God even cares about our physical health. Psalm 147 verse 3 says, He heals the brokenhearted and binds up the wound. 3 John 1 verse 2 also says, Beloved, I wish above all things that you may prosper and be in health, even as your soul prospers. Promoting women's health is essential not only for individual well-being, but also for the health of families and communities. When we look after a woman, we are looking after the whole family and the whole community. So this is the women reproductive system. Excuse me. It has the fallopian tube, the ovary, the uterus, and everything. And when we talk about women's reproductive health, it involves having access to family planning. When you have an access to family planning, you are able to plan your family well. You are able to raise a healthy family. You are not having kids every 10 months. You are able to raise a healthy family. I remember when I met my husband, we planned to have 4 kids. But Canada changed that for me. So I'm only able to have 2, not by choice. I mean, it's by choice because I don't want to have because of the environment I am. If I'm in Nigeria, I will have had my 4 because the support are always there. So family planning has helped me to achieve that. Then when we talk about women's reproductive health, it also involves prenatal care. When women have good prenatal care, they have healthy life and bring about healthy babies. So it helps with healthy mom and healthy babies. We also have safe childbirth. When a mom have a safe childbirth, we are able to prevent complications in the part of the mom and the baby. Then postnatal support as well. Postnatal support prevents any problem that comes after childbirth. For example, like postnatal depression is something that's very common in this part of the world. Back home is not as common because the support are always there. Even people that doesn't know you, when they hear you had a baby, they come to help you. So menstrual hygiene is also part of the women's reproductive health. When we are able to manage pain and prevent stigma, there are still part of this world that when a girl is menstruating, they can't go to school, they can't go to public places. There are some churches that I know in Nigeria, when you are menstruating, they see you as a dirty person. You can't enter the church. It shouldn't be so. Women's reproductive health, we have to be able to manage pain and address stigma. Fertility is also part of it. You know, in our culture, I'm sorry to say this, when a woman doesn't have, a family doesn't have a kid or there is a delay, we always believe women we are the problem. Oh, maybe she has lived a wayward life, maybe she doesn't even have a uterus. Nobody ever thought it could be from men. It could be low sperm count or any other thing. Women always carry the blame. The last one is the menopause. A lot of women deal with menopausal symptoms. Not all women have these symptoms. It's like having a baby, it's like being pregnant. Not every woman have nausea and vomiting. Some women, they can throw up from the day one till they have the baby. Why some women, they don't even have those symptoms. So the same thing applicable to menopause. Not every woman have these undesirable symptoms, but it can be well managed. It can be well managed by hormonal replacement therapy. So I'm going to tell you some of the list of the signs and symptoms of the menopause. And you can always Google them, like hot flashes, night sweat, irregular periods, vaginal dryness, which makes intercourse unenjoyable or painful. Sleep disturbances like insomnia, not being able to sleep, joint and muscle aches, dry skin, dry eyes, and dry mouth. Reduced libido, you don't want to have sex. Anxiety and depression, when there is changes in the hormonal system, you know, when you're going into menopause, your estrogen is significantly reducing as you aging. So the anxiety, depression, mood swing, irritability, you can be happy this moment, the next moment you can be very sad. It's not our fault. It's because of the hormonal changes in us. Then weight gain, a lot of women deal with this. I remember when I was younger, it's easier for me to lose weight than to add weight. Now I realize it's hard for me now to lose weight than gaining it. No, it's easier for me now to add weight than losing it. So we will all discover that we will retain fat on our tummy. A lot of women, we have issue with our tummy. Then we could have palpitation, tinnitus, ringing of the hair, then changing in the hair and nails. Your hair becomes very thin. That is a sign of menopause. So I'm also going to share common diseases affecting women. We have a heart disease, such as hypertension, which is the high blood pressure, any pressure higher than 140/90. Congestive heart failure is when heart cannot pump blood effectively. Arrhythmia, which is irregular heartbeat. Dyslipidemia is having abnormal levels of lipids, which we call high cholesterol. Diabetes mellitus. Diabetes mellitus is having high blood sugar in our system, or diabetes insipidus. This is when the system is unable to regulate water imbalance. Then it results to people urinating a lot. So hypertension and diabetes. A lot of pregnant women can develop this during pregnancy. The hypertension, we call it pregnancy-induced hypertension. Then the diabetes, we call it gestational diabetes. In most cases, when these diseases are being treated well, after childbirth, the woman can live a normal life. But in some cases, when these two conditions are not treated well, the women can live with this for the rest of their lives. And this hypertension and DM can result to renal problem. So can't you see that women go through a lot? Some women lay their own life down to bring forth a new baby. So the next one is cancer. Cancer can come in different forms in any part of the body. But the ones that are prevalent to women are the breast cancer, ovarian cancer, cervical cancer, colon and uterine cancer. So all these cancer I mentioned, good screening can help prevent them, can help identify them early. Because when you diagnose them early, it helps with the prognosis, which is the outcome. You have a good outcome when they are detected early. But I'm going to dwell a little bit on ovarian cancer. Ovarian cancer is the only cancer you cannot detect early because of the subtle symptoms. The subtle symptoms make it difficult to diagnose it early. Before an ovarian cancer can be diagnosed, the cancer will have been getting into either third stage or end stage. Because a lot of people that have ovarian cancer, they don't even have symptoms. They live their normal life. They don't have symptoms. I have a friend that had got ovarian cancer. She was in school. She was going through a lot of stress. I think the stress masked the symptoms. And the tummy was getting bigger every day. She thought she was adding weight until people was asking her, "Are you pregnant?" That was when she realized that something was wrong with her. By the time she went to see her GP, she had an ultrasound, CAT scan, they diagnosed her with end-stage ovarian cancer. In fact, she was given 6 months to live. But as God will have it, she got 5 years. So we lost her a few years ago. She was a very close friend of mine. So ovarian cancer, I will run through some of the symptoms, people that had it, what they felt when they had it. The common feelings that they usually feel is bloating. When you eat a little food, then you feel so full. You feel bloated all the time. That symptom is very common to them. Some people have abdominal pain, abdominal discomfort. Some people have changes in their bowel habits. Is it that they have constipation or they have diarrhea? Then fatigue is very common to them. Fatigue that doesn't improve with rest. You are tired, you rested, but you didn't get better. There's a problem. Please check yourself out. Then unexplained weight loss. Like this, my friend, she didn't lose any weight. In fact, she was getting bigger. So all these symptoms, they are not one size fits all. You just need to know yourself, listen to your body, and know when things are not going well with you. So the next one is the mental issues, such as anxiety and depression. You know, women often juggle multiple roles, which can lead to stress, burnout, and emotional strain. And also the hormonal changes also affect her mental health. I have a friend, she was stressed. She got burnt out and she was slipping into depression just because she was stressed. She has to start seeing a counselor, therapists before she got better. So women, we go through a lot. We handle so many things in the house. So many things. You are the mom, you are the wife, you are the cook, you are the teacher. You know everything going on in the house. When things go wrong, your kids will come to meet you. They won't go to their dad. I remember my kids when they were younger. When I'm upstairs, things go wrong downstairs, they'll come upstairs to meet me. I will send them back. Your dad is downstairs. Go and meet your dad. So kids, they are so used to coming to their mom. We handle so many things in the house. So the way we can deal with these mental issues is creating supportive environment for ourselves, then having access to mental health resources, and breaking stigma. I wrote breaking stigma is the Black communities, we don't do well with mental health. Nobody wants to share their problem with you because of the stigma. I think we will get there one day, but we still have a little bit challenges with that because of the stigma in our community. So the last one is osteoporosis. Osteoporosis is the reduction in bone mineral density. And you can only diagnose this by doing the investigation. We call it silent disease because it develops slowly over years. It doesn't come in a day. So the bone becomes thin and porous and less dense, and it can lead to fracture. Just little thing, that person sustained fracture. So you are wondering what happened. So, and this can be prevented by, we take a lot of calcium and vitamin D. They are all recommended for women. Drink a lot of milk, please. Yeah. The next slide. So I have some data here. This data is only limited to Canada. So, and cancer is #1 leading cause of death in Canada. 86,700 Canadians will die from cancer in 2023. Over 1.3 million potential years of life lost to cancer. 239,100 Canadians will be diagnosed with cancer in 2023. 2 in 4 Canadians will develop cancer in their lifetime. 1 in 4 will die from cancer. Cancer is becoming too common. Yeah, let me put it that way. It's becoming too common. You know, there are some cancer that you can have it due to age, but now people have, like the breast cancer, breast screening in Canada used to be 50. When you are 50, then you can start having the breast mammogram, ultrasound. But now they have to change the guideline. They have to change it because young people, old people, they are just having it. They're just having breast cancer. So it's not limited to age again. So the guidelines are changing fast to meet up with the way cancer is affecting people. So after talking about the common diseases affecting women, how do we prevent these diseases? There are some diseases you cannot prevent. They will show up, but early diagnosis will help the prognosis, will help the outcome. like regular medical checkups. Going to see your doctor once in a year is very, very important. At least once in a year, you have your physical checkup. They will do your physical, we call it yearly physical here. Yearly physical and blood work. They will run all the necessary blood work. Even things you don't know that is going on in your body, you will know. I have a friend, the husband, she's a very close friend. The husband wanted to enroll for an insurance. So the insurance requested for blood work. So, and they want him to do the PSA for the prostate. He was even angry with them. Why are they asking me to do that? What's the relevance? He did it, and they realized the PSA was very high. So, and once it's high like that, you follow it up with biopsy. Biopsy is they take a little tissue from the prostate to determine if it's cancerous. So he did it, and it was cancerous. So luckily enough, the cancer has not spread. So they were able to do the surgery and remove the whole prostate. So that insurance saved his life. That insurance saved his life. And this guy, in Canada, once you are 50, you can do the prostate screening. He was 52, he didn't do it. He didn't do it. So thank God that insurance saved his life. So he's doing okay now after the surgery. So regular medical checkup is very, very important. Please don't be too busy for yourself. What I always tell myself, I will say, oh, that's all they require from me. But people in Nigeria, I know they require more than that from you. You have to pay for these things, and they are not cheap. So I recognize that. So for women, pap smear to prevent cervical cancer is very important. It's recommended between age 25 to 69, or when that person becomes sexually active. That is the guideline. That is Canadian guidelines. So I don't know what operates in other part of the world. So once you become active, either you become active at age 18, you have to start doing it. So they do it every three years, because research shows that the organism that causes cancer on the cervix takes the organism 3 years to fully develop to cancer. So pap smear is recommended every three years. Once you have good ones, normal result every three years. It's very important. Women don't like to do pap smear, which I understand. A lot of women don't like to do it because it's very invasive. You don't like to open up to somebody you don't know. Because I work in the operating room theater, and I saw this woman came in one day for examination under anesthesia because she was having abnormal bleeding. So they brought this woman in. As soon as the doctor examined, we discovered this woman already have a third stage cervical cancer. Third stage cervical cancer. So the doctor couldn't do anything for her. So when we interviewed this lady, that haven't you been doing pap smear? She said, oh, I've not been doing it because my doctor is a man. I don't like to do it with my doctor. So this experience was the one that caught my attention to helping women to address this issue, because a lot of women don't want to have pap smear done. They avoid it because of one lady was telling me that if men also do mammogram and pap smear, they will have looked for a more convenient way to do it. But they don't care about women. So they don't care what we go through. So that was a a great call for me that, okay, I also work in a family doctor's clinic. I think I could help to perform this pap smears for women that are not comfortable for men to perform their pap smear. So I've been doing that now for about 7 years now. I've been doing this women's health clinic and helping women with breast examinations, pap smear. So for breast cancer, the screening is also important through mammograms and ultrasound. So the guidelines here is between 45 years to 74 years every 2 years, depending on your condition. If breast cancer runs in your family and you have removed lumps before, you can do it every year, depending on the radiologist's recommendations. But mostly it's every 2 years if it's just the regular screening. And I also want to suggest the self-breast examination. This one is very important. You don't need doctor to do this for you. You do this in the comfort of your own house. You can always find the video on YouTube, self-breast examination. You have control over this. You can do it every day. Every day, you can do it. Every day, if you notices any changes, any lumps, any discharge, any changes, then you follow it with your doctor. It's very, very important. Then there's another one, fecal immunochemical test. We call it FIT test. This FIT test is done between 50 years of age to 74 years of age. And it depends on your doctor. Like this FIT test, I started doing it very early, maybe when I was 45. Because my doctor is from Nigeria. She's also my friend. So she will ask me, what do you want? I tell her, please, I want it. I don't even pay for it. So why can't I do it? So I've been doing that. So this FIT test helps to diagnose if there is any growth in your colon, in your intestine. If there is any tumor, it helps to diagnose that. It helps to pick it up early. The sample you need to provide in this FIT test is your poop. So if there is any blood in your poop, then they will follow it up with colonoscopy. Colonoscopy is when they use a camera to check your colon to make sure there is no tumor in your colon. And this, I'm going to tell you about my friend's story. I have a friend, she lives in US. So she went to Nigeria. And I was just on the phone with her. Then she was like, for me, mo need constipation all the time. Mo ní constipation, mo ní bóyá ìgbẹ́ ẹ̀ ń tijú ni. Like me, when I go to strange places, I don't go to the bathroom. I don't use the toilet until I go back home. So, and she said no, that this problem has been going on even when she was at home. Oh, then I told her, when you go back, please make sure you go do this FIT test. I hope there's nothing growing inside of you. So luckily, as God will have it, she's somebody that doesn't care about things, but she went to do this. And she did this FIT test, and there was blood in the poop. So they followed it up with colonoscopy, and they discovered this big polyps, big tumor in the colon. In fact, usually they remove it during the same procedure, they remove it, but they couldn't remove it because it was too big and there is a risk of bleeding. So they have to schedule her again to bring her to the theater. So luckily for her, this tumor was removed. It was benign. It wasn't malignant. No, it's not cancerous yet. So thank God she took a step to help herself. So what I'm saying in essence is checkups, medical checkups, screening, all these things, we cannot prevent them 100% from coming to us. We cannot. But we can always diagnose them early. And once they are diagnosed early, they can be treated before they become something that we cannot be treated. So for stress, when we go through stress, we cannot prevent stress. We cannot prevent being stressed, but we can manage stress effectively. What we can, because when we go through stress, our body releases chemicals that work against our body. Our body doesn't need those chemicals, so they work against our body. But when you want to, we can manage this stress well, especially women. We are not superwomen. We call ourselves superwomen. God has not created any superwomen in the Bible. God created virtuous women, but not superwomen. We made ourselves superwomen. And there's always a problem where you are making yourself what God has not made you to be. We should try to delegate tasks. We should try to delegate tasks, especially African women. Our men thinks every chore belongs to us. We have to do every chore. We have to do all the runs around. We have to cook, and we still have to satisfy them in bed. God has not created us that way. God made us helpmate, helper to them. One of my friends will tell me that God said we should help them. Now they put all the load on us. So we are to help them. We are not to do all the work. We should try to delegate tasks. We should try to listen to our body. Listen to our body. Don't push yourself through any situation. If you cannot do something, pause. Pause and rest. Listen to your body. Sometimes we think, oh, if I don't do this thing, nobody will do it. If I don't do this thing, nobody will do it. People are there to do it. Your husband that you think he cannot manage, when you are no more there, it will function perfectly well. Your children that you think they cannot do without you, you'll be surprised they will thrive well when you are not there. Because that my friend we lost, the one that had ovarian cancer, her life has really taught me a very good lessons, a very good one. Before she died, the husband used to be a man that is the wife that we think for him. He can't do anything independently or conveniently. It's the wife that does everything. But when the wife died, he functioned very well. He functioned very well. So don't think that if you are not there, nobody will do it. People will be there to do it. I can assure you. And your children will thrive well. It's just that you will deprive them the joy of having you around when they are graduating, when they are getting married. Please listen to your body, delegate tasks, and take time off. Not from work alone, not only from work. I know some of these things can be difficult because when you are off, that is when you want to do your grocery shopping. That is when you want to cook. That is when you want to run your appointment. That is when you want to do a lot of things. But you can know when to stop. Observe a downtime. Sometimes I don't even announce it at home. When my body tells me, one of my lecturers told us that if you don't choose a time to rest, your body will choose a time for you. And that time might not be a convenient time for you. It might be sometimes, it might be a time you have a special function, you have a special thing to do in your life. Your body will choose that time for you. So always choose a time to rest. Have a downtime where you can rest. Sometimes I'll just be in my bed and everybody will be expecting dinner. And I've told myself no dinner tonight. And my kids, they come on. What are we going to eat? I don't know. Go to the kitchen and find something to eat. I'm not cooking tonight. There are some weekends I will just be, because most of my days off are on weekends. I will just be in my bed all day watching Netflix. If you want to eat, find something to eat. Before I know it, they will order or they will cook. They just sort themselves out. So you have to do that. You have to learn how to do that. As a mom, as a wife, you have to learn how to have your me time. This is my own time, nobody else. It's not my husband's time. It's not my children's time. Pamper yourself. Pamper yourself and rest. So, and for the bone mineral density, you can do the test too, is that when you are 50. And they advise us to also add exercise. Exercise to prevent losing that mineral density in our bones is very important. Lifestyle changes is very important. Don't live a sedentary life. Just eat and sit, eat and sit, eat and sit. I told you to listen to your body, because that was sometimes last year I hurt my shoulder at work. So I was at home for 5 months and I added just 5 kg only. That 5 kg only was not doing my body any good at all. I was having sleep apnea. And when I'm at work, I struggle to keep my head up because I'll be feeling so sleepy at work. I will have pain. So I had to tell myself that I think you have to lose this weight you gain. It's an extra luggage for me. It's not doing me any good. So I started exercising and I lost this weight and I was good again. And the sleep apnea was gone. So listen to your body. Because something is working for somebody doesn't mean it's going to work for you. Listen to your body. So I have the final tips and takeaways. Although we are here for women today, but I also want to say a little thing about men too. You know, when your husband is doing well, your children are doing well, that's when you are doing well. Because I remember there was a time I was sick. I think I had COVID then. I was so sick. I was in bed. As soon as my kids got the COVID, I had to push myself up to help them. That's what mommy do. That's what we do. We put our own life aside to help our children and our husband. So please, as you look after yourself, you encourage your husband too. Men, they don't look after themselves. They don't, regardless of their profession. Even if you have a doctor, regardless, they don't look after themselves. So you as a woman in that house, if you want to have a good life too, if you want to have your peace, if you are dragging yourself to see your doctor, please drag your husband with you. When somebody is at 50 years old, the PSA is very important, the prostate-specific antigen. That one helps to diagnose if there's any enlargement of the prostate. There could be enlargement of the prostate without being cancerous, but the end result is not good. So we have to do something about it, because prostate, the prevalence among African men is very high. It's very, very high. So make sure your husband also see a doctor for regular blood work every year. It's also important. So the final tips and takeaway: prioritize preventive care. The preventive care is seeing your GP for regular checkups and blood works. Blood works will show, I want to say something. The way God made our body, God is so perfect in his own way. Before your body starts showing any symptoms, the damage is already going on. Before your body starts showing any symptoms, the body have fought that illness. Your body, the way God made the body, your body have fought that thing so much that it got weary. of fighting, couldn't fight it anymore, then it will relax. That's when you start having symptoms. So when you are having symptoms, feelings that you've never had, the feelings that you didn't have yesterday, you started having it today, I want to assure you that the damage has started a few days ago, not just today you started having the feelings. Go see your doctor. Don't delay. And by the time you are doing self-medications, paracetamol doesn't fix all problems. By the time you are delaying, you are trying to do self-medication, the damage continues. The damage doesn't stop. The process doesn't stop. So that's why you go see your doctor every year. And if anything comes up, go again, go and see your doctor. Regular checkup is very important. Don't be too busy. Then eat a balanced diet. Limit processed food. They are all garbage. Eat healthy food. Stay physically active. Exercise. Exercise is very important. Exercise as tolerated. Keeping fit is even if it's just taking a walk, is very, very important for us, especially for our age. Exercise is very important. Then manage stress and mental health. Seek help. Don't keep things to yourself. Don't bottle things inside of you. Talk to people that can help you. Practice relaxation techniques. Then get quality sleep. You know, menopause will take your sleep away from you sometimes. Some people, not everyone. Or you can request for sleeping pills. I've been taking sleep. I'm not in my menopause already, but I've been taking sleeping pills for a very long time now. Because since I started having kids, I couldn't sleep. I've been taking sleeping pills because if you don't sleep, you cannot function. And when you don't sleep, the things that goes on in your body, the therapy, the things that happens, it cannot happen. So you have to sleep to be able to function the following day. If you don't sleep, the hormones that releases in your body works against your body. So taking sleeping pills will not end your life. 7 to 9 hours of sleep is recommended. Then practice reproductive health and sexual health. Understand menstrual and menopause health. Seek help for any undesirable menopausal symptoms. People do very well with hormonal replacement therapy. You know, when you go into menopause, your estrogen level is reduced significantly. Then they give you estrogen to balance up. Then you do well. People take estrogen replacement therapy and they do very well. So I always tell people, when your case, you can treat your case with medication. It's a miracle on its own. You should be happy. There are some cases that cannot be treated with medication. So you should be happy that if medication treats you, some people, they don't want surgery. If you go through surgery and you leave, you should be happy. You know, sometimes when I see people in the operating room where I work, they have cancer and they come for surgery, my mind always go back to my friend. That, oh God, how I wish you can give my friend a second chance like this person. How I wish you can give my friend a second chance like this person. So if your case, you can still manage your case with medication and surgery. It's a miracle on its own. You are one of the lucky ones. So, and limit risky habits like smoking, alcohol, medication. Use medication responsibly. Don't just continue to throw medication. As simple as paracetamol is, you know, it damages liver. It damages liver when you take it too much. If you take more than 4 grams in a day, which is 4,000 milligrams in a day, it can damage your liver. You can imagine men how they take paracetamol. They take paracetamol to treat every issue. So avoid alcohol. Now, there's this new research that came out that they said that alcohol causes cancer. Yeah. So, and avoid toxic relationship. I'm happy Sumba was able to talk to us about this violence against women last week. Because this toxic relationship, it affects our core, the core of our being. It affects you physically, mentally, and emotionally. So when you don't run away from toxic relationship, it affects you. The end result is not good. So build support system, stay connected with families and friends. Research shows that social support improves mental and physical health. Connect to friends, because a friend disappointed you doesn't mean there are no good friends out there. Doesn't mean there are no people you can trust out there. Just prayerfully choose your friend. Prayerfully choose your friend. Don't isolate yourself. Don't build a wall around yourself that, oh, I don't want to talk to anybody. You can't do life all by yourself. Please. Because of our time, I think I've exhausted all my points, and it's very important. Encourage your partner to have a regular checkup. Men don't take care of themselves, because before a man can go to the hospital, you know he's dying. I remember when I was in nursing school, we called main medical ward mortuary extension. Every day somebody dies there. Every day. And it's because they don't seek medical attention on time. That's why they die like that. Women, we are known to look after ourselves. I think I've exhausted my point now. And if there is any question, contribution, please, you can come in. Any question, any contribution? I will stop.
Well done, Funmi. That was a very good presentation. Thank you for your time. Thank you for all the friends are meeting.
Thank you for coming.
You shared some things that really spoke to my heart. And there are two: men's health and the issue of it will not be my portion in Jesus' name. I know we are all Christians or Muslim faithful, and we believe so much in God. I'm a kidney transplant person. I did kidney transplant 16 years ago, and I've been on medication since then. I've had people come to me and say, this money you are using every year, because they run into millions, that medication. Why don't you carry it to the altar and go and give it to God and tell God you don't want to take the medications again? And my answer is simple. I tell them, for me,